Greetings, everybody. Welcome to the September 13th, 2022 Advisory Board of Health meeting. We have all members present. The first order of business is to review and approve the meeting minutes from June, which were sent out after that meeting and attached to the agenda for this meeting. Any objections to adding those and making them go from draft to final? I hear none.
No
Everybody gives a
objections.
thumbs up. Great. The first and only order of business is the report from the Department of Health. So, David.
Well, there's a lot going on, and I'm going to run through this really quickly, but I will pause at every subject. So if there's any questions, we can discuss them then. I'd like to start with a staff update. We were very fortunate over the past couple of months to have coverage while our office administrator was out, to the extent where we were able to continue functioning. We had a student intern who spent the first month, or last month of her senior year working with us, and she stayed on for the summer, just to the day when our admin returned. And between her and our contact tracer who came into the office and continued doing our weekly reports, we were able to manage to keep our administrative function completely, above water, and it worked. So hats off to those folks who helped out during that period of time. That would be Brooke Dolan, who was the student intern, and Cheryl Montoya, who is our contact tracer. So Michelle is back and is fully up to speed, and we're back running. Mindy Shambrelli, our sanitarian, I'm pleased to report, got a National Scholarship Award at this year's National Environmental Health Association Annual Education Conference, which was held in Spokane. She was the only one to receive the Graduate Scholarship Award, and I wanted to make sure that she was recognized for that achievement, and she will
David,
be.
What was the name of that award?
It was the Graduate Scholarship Award from the National Environmental Health Association. There's one that was issued across the country, and she's the recipient. She said there were 500 or so inquiries on the scholarship. I don't know how many actually applied, but I'm pleased to report that she's the person who was selected to receive the scholarship. She'll finish her MPH, Masters of Public Health program, in May of 2023. So that's good news. Kevin, you'll be in particular, moving on, interested to know that the State Health Department has decided or has changed the requirements for emergency preparedness staffing. They're no longer allowing us to have independent contractors such as Nick. So what we have to do is we have to hire him part-time if we're going to keep him on. And it kind of works out okay, because what we can do then is consolidate his activities through the ARPA work that he's doing, through public health preparedness work that he's doing, and the ELC fund work that he's doing, and create an umbrella job description, noting that the position is going to be fully paid by grants. There's 3 different grants that he'll be paid from, but they're not going to let us do it as have him be a subcontractor any longer. It's a requirement they put into effect statewide. It wasn't directed at us, but it certainly affected us. So we create a job description and add a new part-time person to our to the town. That's it for staffing matters. We have scheduled and we'll be holding seasonal flu shots, flu clinics. Dates for those, there are going to be 2 scheduled at the Mather Center, October 13th and October 27th. Both of those are Thursdays from 9:30 to 11:30. We'll also be holding flu shots. These are by appointment only, and the appointments can be made on through our website, which is www.darien.gov/flu. The scheduler will be set up and operational tomorrow. The other clinics are going to be held in room 19 in the town hall, and those will be on Tuesdays, October 18th from 9:30 to 11:30, October 25th from 2 to 4, November 1st from 2 to 4, and we will be once again resurrecting Vote and Vax on Election Day, November 8th from 3 to 7. And that will not, there will be no appointments required for that. That's going to be an open clinic, kind of going back to the old days, unless God forbid, we have issues with COVID. But at this point, we're kind of going back to the new normal, right? New normal is having meetings like this. Prior to COVID, this kind of meeting didn't really exist, right? So, you know, we've learned some good things.
David, just to clarify, so all these these are all by appointment only, except for the Vote and Vax date?
Correct.
Okay. Thanks.
Yeah, that way we can manage it and spread it out more. It was very efficient. We've done it that way over the past 2 years, and it works very well, in and out for folks. And because when you just have it, you know, open all the time, it seems like people come in waves. So we go through periods of time where there's no one, and then all of a sudden everybody comes at once. Just, I don't understand how that happens, but it's kind of like traffic on I-95. So it's always bad. So moving on, any questions about our flu shot program, seasonal? Okay, we'll briefly talk about COVID. I circulated the weekly report today along with the monthly report to you folks. And I think what's interesting is, in particular last week, the monthly report, it shows the change of variant, which is substantial. And what that really kind of boils down to is that the vaccine that was originally provided, that everybody got their shots for, boosters and whatnot, was pretty much for a different coronavirus than what's circulating now. So the advice of CDC and the State Health Department is there's a new vaccine that's available that includes a protection against the new variant. And the recommendation is that those who are eligible, which is, you know, most of us, to get that. Now, we're not planning on offering COVID vaccine. There's a lot of providers in the area. We've checked with both Greaves and CVS. They will be offering the vaccine. And if we're to do it, we have limited access to staffing. We relied on volunteers the last time. CVS and Greaves are there every day, and they have people who can administer vaccine as the public needs it. So we think it's far more efficient for people to get the vaccine at places like that than through us. So we're not planning to offer a vaccine. And also, another reason we're not planning on offering it is because people aren't calling us and asking for it. So there's no real public demand that's been directed to us to say, you guys did such a great job. Can you do it again? We have gotten compliments from the way we managed the clinics before, but at this point, we're not being asked. And we haven't been requested to run any clinics in town hall. Sure, I got everything. There is an issue that's come up about the vaccine, or not vaccine, but the COVID test sites. We have 2 in town, one at the church, and of course the one that's been at Leroy West train parking lot for 2 years. Well, it's come to our attention that that particular trailer is blocking access to track maintenance. In 2 years' time, it wasn't until last week that it was noticed that the trailer is square in the middle of the access to the tracks. So we had a conversation internally in town hall, and also I've been in contact with Dr. Moore, who is the head of Everpoint, and who set up that clinic. And it's really not being utilized very often. I mean, they may have as few as 2 a day, 1 a day, 4 a day at most. So the fact that it's blocking the access, that's the access way where the construction project to rebuild the platform at the Darien train station, series of reasons to say, and if the lot is becoming more full with commuters, it looks like we're going to be closing that test site probably by November. We just have to finish discussing that with Dr. Moore. But the other facility will remain in operation for the foreseeable future. I've been assured of that by Progressive, who's managing that site. So we'll still be able to offer the testing locally to residents.
And where's that other site, David?
St. John's Church on Post Road. And they're there in the mornings every day during the week. I think it's 9 to 12. And you don't need an appointment for that one. And results are obtained within 6 hours. And it's been in the news. I'll mention it. Monkeypox. We haven't had any cases in town. I knock on wood when I say that. But we check the state database all the time to ensure that that's the case. But so far, so good. So that's our COVID, flu, and monkeypox situation. Any questions on that from the folks? Suggestions, comments? It was a good run with the Everpoint. And again, that was one of the first in the state for a drive-through test facility. And it served the community well. And I'm proud and pleased with the work that we did in getting that set up and functional for as long as we have. It was a good partnership there. So emergency preparedness. We are currently Monica, our first select woman, has directed the town to come up with a kind of a referral page, as it were, for residents in preparation for storms, extreme events, kind of telling the community what it is that town does, what various departments do, and to have a good organized reference point for residents to go to for advice. So we've contributed a couple pages of kind of outlining what health department role is starting 4 days prior to a storm, and kind of outlining our preparations, our notifications. We, reach out to food service facilities and places that are subject to flooding, businesses and whatnot. These are the types of things that we're going to be contributing to this. There's going to be a PowerPoint that's going to be developed and available in October. I think this is a really good initiative. I'm pleased to be part of that. Another part of it that we're going to be offering is basic guidance to the public, food safety in a storm and flooding, water safety, drinking water, and kind of this kind of warning, flood water without a doubt, contains sewage. People need to know that, and they shouldn't be walking through floodwaters with flip-flops, which, happens. So, but this is part of kind of this overview and kind of general reference that will be available to residents in the next month. And I believe we're planning on presenting it to the Board of Selectmen at their meeting on October 3rd. So I'm pleased with that. I think it's a really good initiative. Software. We have begun the process of coming into the 21st century. We're working with the software company and with the financial company to set up a online payment portal, permit applications, and we are planning to have this be ready for when our food permit renewals are come due, which is at the end of December. We've been promised to have this thing functional by the middle or end of October. So that'll give us some time to play with it and hopefully, work some bugs out so that when we do the food service permit renewals, it's going to be, last year was 150, this year it may be pushing, seriously, up to 175, getting close to 200. And I'll discuss that in a moment too. But we are getting the online payment system set up now, and that's very exciting. That's been something that we've been trying to work on for the past couple of years, and I think we're using the ARPA funds for that. Talk about ARPA. Kevin, you want to kind of fill in everybody about what's happening with that and what you and Nick are doing?
Sure. So the funds, as you know, as of the last meeting, have been approved at all levels by the ARPA committee, then by the finance committee, then by the Board of Selectmen, then by the RTM, then by this group. The one particular germane to us is the Pod in the Box project, where we are pre-buying many of the supplies we used during our COVID clinics, so we do not have to scramble to get those in the event we had a year, but in the next one we might not. And if we get a pushback from the National Strategic National Stockpile from the CDC, we have 48 hours to set up a clinic. It will be here in 72. So we're going to pre-purchase all that stuff. I sent you all the list. We put it in the minutes of the things that we are purchasing. The first step is to buy the trailer to store all this stuff in. The trailer will likely either be stored at Town Hall, the police department, or Post 53. At the moment, maybe Post 53 is probably the most likely candidate for a couple of reasons. During storms and flooding, the Town Hall and the Darien Police Department are inaccessible. So if need be, we can move it around, but at the moment, that's the working theory. We'll get the trailer, we'll get it set up. It's quite a little bit of a purchasing process because stuff has to go to state bid. And then once we get the trailer, we will then start ordering the supplies to go into the trailer. But David, I think we have like 2 years to um, uh, to actually requisition this stuff. So we're certainly not going to take 2 years, but it is a little bit of a process. Once we get the trailer in our possession, then we'll start ordering many of the supplies, radios, um, tables, chairs, papers, pen, all the supplies we would need to run a emergency clinic.
Yeah. Thank you. Any questions about that? Again, we can take it on the road, right? I'm going to talk about food. I mentioned that our permitting and food service and food protection program. First of all, I'd like to say that, I think I mentioned at the last meeting about the project that I've been working with the state and other local health departments on for permit reciprocity for itinerant vendors. That's the food trucks that go around, and they can go from fairs to events. They sometimes are at Weed Beach. And so what that would do would be that they get a permit in one jurisdiction, and they can utilize that permit and go elsewhere. And currently, there's no mechanism for that. So trucks that get a permit in Darien or in Bridgeport or in Norwalk have to get permits in each town they work in and pay and apply. So it's a pain. So there was legislation passed that would mandate that a program be developed with local health and cooperation with the Department of Public Health. And we've done that. And we came up with a plan to allow for reciprocity. And I presented it to Monica. And Darien was the first town in the state to sign on to this MOU, which would enable us to have that permit exchange and inspection report exchange with other departments. The advantage to us would be if somebody comes in from, say, Fairfield, and they had a permit from Fairfield, we could access their permit information online. The state is maintaining a database as part of the MOU that we could access. Look at the permit information and the most recent inspection information and know all about the trucks that are coming in to our community if they're from Fairfield. So that's only for those who sign on to the MOU. It's a win situation, win-win for local health departments, because it means they don't have to do all the work of issuing permits and doing the inspections if they're available. But we can do the inspections if we so choose. And it saves the vendors from having to get permits everywhere they go. So it's a project right now. I think there are 12 jurisdictions that have signed on, and there's 60 some odd in the state. So we have a ways to go until it's 100%. But I think once people see how well it's going to work, and I do believe it's going to work well, I think that people will fall in and make this thing work and work well. And be protective of public health. Because the thing is now, if a truck is a bad apple and they have a bad inspection someplace and they go somewhere else, we're not going to know. But with this reporting system that's going to be available, we will be able to see other inspection reports. So there's a real value to health departments and to the public in having this thing be available, as well as a savings to the vendors. In part, and as a result of that, we really have to take a look at our food regs and our definitions, and also the impending, and it still is, impending FDA food code adoption and implementation in Connecticut. I have a feeling that it's going to come. They actually the state posted the regulations in the summer. And so that's a step looking for public comment. I submitted comment because one of the requirements under this new law would be that every food service facility in Connecticut would have to register with the state health department before they could get a local permit. Now that's tens of thousands of food service facilities that would have to register with the state before they could get a permit locally. That's renewals, that's snack bars, that's itinerant vendors, that's everybody. I just think that it's creating a problem where there doesn't seem to be a need to have that. So I submitted testimony against that requirement or that component of the new code adoption. See where that goes. New facilities. As I said, we have reviewed. We're very fortunate because we have one of the, I think, premier people available in Connecticut that has agreed to do our food service plan reviews. Lori Romick, who was our inspector until last year, and she retired, but she agreed to stay on to do plan reviews. 23 new facilities since the first of the year. Now that's new construction in Federal. That doesn't count anything that's happening downtown because we haven't seen any plans for new food service facility in the downtown project yet. We're just working pretty much with Federal Realty, where Stop and Shop used to be. There have been a couple of changes in some facilities, but that's a big chunk of work for plan reviews. Now that means those are new facilities, so we do inspections as the facilities are being built, and then we do inspections obviously before they open, and then we want to make sure that they're building those places out in accordance with the plans. Last year, I had asked for another full-time person to be able to help us do this. And that was, as you know, wasn't passed in the budget, but the door was left open to have future discussions on this need. We had a department head meeting today, and I posed this point to Kate and let her know that, you know, I'm going to be coming to see her about this issue because we're not going to be able to maintain our regular inspection program and do this level of work on a continual basis because there are more facilities in the pipeline. So I'll be in touch with you about how to go about this, and I'm not exactly sure how many more part-time people we want to put on staff, but that might be the way to make this work because we also have an office area limitation. We don't really have another place to put a full-time person. We're already juggling 2 part-time people in our smallest office facility now. So, but we're definitely going to need some assistance when it comes to just this whole regular inspection process. Plan review, ensuring the the facilities are being built in accordance with the plans, and then making sure they're operational. Because they're going to have to get staff from somewhere. And a lot of these people who go to work in food service facilities don't have a lot of training. So we're going to have to make sure that people are trained. It's going to be an interesting couple of years ahead of us, I think, as
David,
for the whole community.
Did Kate remember her promise to you?
She seemed to she wasn't shaking her head this way. It was a little bit kind of like, yeah, I kind of thought so, kind of body language today. But you know, it's impacting all the departments. You know, it's not just us, obviously. You know, so they've added a full-time fire marshal and another part-time fire marshal. So that department has gotten some additional staffing.
David, I have a related issue that was brought up to me this weekend, and it may be something you might think about bringing to Kate at some point. Somebody shared with me this weekend that they witnessed a woman coming into some place in the evening where they served alcohol, and the bartender, and she apparently was inebriated coming in, or at least under the influence, and was told that the bartender then served her 9 drinks. Okay, and I don't know what the upshot was, if she went off and drove a car or what, but how does this get reported, and to whom, and who's responsible for checking on, this is after hours, and if we have a lot of other places, establishments opening up in town, that people do comply with the alcohol, whatever, who does that training to cut people off if they've had so many drinks per, time period. So who enforces this, and how does somebody report it?
Police. It's a police matter.
It's a police matter.
Yeah, it's not a health department matter. So that's not an area that we have jurisdiction or control over.
But the training I know that, yeah, they have training for bartenders. Okay,
Yeah,
so is there some way that maybe Darien could go into some of the bars and have refresher classes when you start training about food service and whatnot? Can that also be some kind of alcohol education to review with some of the people who will be working at those places, or who might be serving, or the managers, if they get a liquor license?
Well, we could take a look at that, but again, we're not even trained in that. So, I don't really have I don't have any background in that particular area, and neither does my staff. And at no point do I know of any other health departments that get involved in that. That would be a matter maybe for liquor control, because
I was on the board of an organization that merged with Alcohol Services Organization, that's what it was called. And so that's how I kind of knew that they have this kind of training, and that they can only, have so many drinks, and then they have to cut the person off. And I think from what I understand, there's a lot of alcohol in Darien, and maybe some of the bartenders might be uncomfortable just saying, look, I can't serve you anymore. To be empowered to be able to, or practice to be able to know when to cut someone off and to actually do it. Because they're also going to be liable. They're going to be liable if they serve too much alcohol and this person goes out and, hit somebody in a car.
And I'm not disagreeing with you, Christine, but, the role that we serve or fill when we're doing restaurant inspections, I don't want it to get confused with, that matter, because then that would maybe diminish our ability to talk about food safety. And, certainly, and when we go into a place, this is where it gets a little kind of funny, because, we go in during the day. And so the bartenders that need to have this type of training are working at night.
Right.
So I would say that for the most part, because there are people who sometimes are in conditions that are questionable during the day too. And so, but, I guess that one thing that could be considered would be to have some handouts that would be given to bartenders, but, they're not going to read them from a practical standpoint. And so, to have mandated training, I'm not sure who would actually do that.
I can find out some of the information for you.
Yeah.
Maybe I'll create an evening job for myself.
Well, I think there's some value. There's certainly value in that, because, there is a great risk associated with people who drink too much and then go out and drive. No question about it. There's been some great inroads that have been made over years where people are tending to take, rideshare and in Uber, but then there's been some bad press about some bad events that have happened with Ubers and whatnot. So I don't know. That's always been a problem
Yeah, I'll find out more about the alcohol training and see how they work that, and see if there's some way that either they have something that we can reinforce with the people who serve alcohol around town,
Yeah.
like you say, a pamphlet or something, and especially with all these new establishments that might be coming in with the building here.
Yeah.
Okay, I'll look into it for you.
All right, thanks. Okay, so anyway, staffing and our food service program and new facilities. Currently, we're okay with our inspections. We have a part-time person who, Cedric Gu, who has been with us since Lori left. He does part-time restaurant inspections, and during the summer, he also did our beach water sampling once a week, and he did inspections of our public pools, checking pH, chlorine, and filtration systems and safety equipment on a fairly regular basis during the course of the summer. That's how we're able to maintain our inspection frequency. Cosmetology salons are also showing an increase in the community, and that's going to continue. We have 7 new facilities since the first of the year. That's a big increase. That's the most we've ever had in a single year. Currently, Mindy's the only person that we have doing inspections of those facilities. Lori also does the plan reviews for those facilities. So again, that's going to push us in the direction of needing to have another person and some more hours to be able to dedicate to doing inspection work, both to follow up on the plan reviews that Lori does to make sure that things are being built in accordance with the plan, and then regular inspections. We inspect cosmetology salons twice a year. That's our goal. Once in October. Permits come due at the end of September and into beginning of October. So we're in that permit renewals phase right now. It's when we review the services being offered by these facilities. And then again, we do the inspections in the middle of the winter, February, March. So twice a year. I mentioned the beaches. We have concluded with the official swimming season, meaning lifeguards and aren't at the beaches any longer. And we're also no longer collecting water samples. We took samples from Memorial Day through Labor Day, once a week. And again, we had a good year. Water quality was good all year. Didn't have any issues. Never closed the beach for water quality again. We had a couple closures early in the season from the downpours that we'd received, but fortunately we didn't have flooding like we did last year. It hasn't occurred this year, knock on wood. So the beach program, we're done for the year. We have a hotline which leaves the messages there, and we'll back at it again next year, Memorial Day. West Nile virus, as every year, mosquitoes positive for West Nile virus were detected in town. And again, I'm pleased to report that as of now, we have had no cases of West Nile virus in the community. I think there's only been one reported in Connecticut this year. So I think in part that may be due to, I don't know, the drought, which we've had. The entire state is still in the declared drought, so I'll move on from the beach to talking about precipitation and the drought. In spite of the fact that we've had a couple big rainstorms, we're still in drought conditions. Groundwater is low. Fortunately, we don't have a lot of wells in town, but people who are on wells need to be aware of the fact that if they're going to be watering their lawn, they're putting their drinking water in the home at risk. And I say at risk because there's a good chance that they're going to use up their water supply. So, irrigation. I know that Aquarion has guidelines for irrigation that's there, actually permanently adopted now. People who have wells should follow that same guidance. They should be careful about the amount of water they use for irrigation. There's not a lot of rain in the forecast either. So these dry conditions are continuing. We had a downpour today in some areas. They're very localized. These are weird storms, they're really downpour in one area and then a couple miles away, nothing. I know that this morning when I came into work, where I'm coming from, it didn't rain. And when I got to Bridgeport, they were talking about how heavily it rained there. So, so the drought is still with us. Radon. We have once again signed on to partner with the State Health Department to get radon test kits to make available for free to residents. We should be getting them in the next month or two. And we certainly recommend that people who are utilizing the lower levels of their home for living space, at very least, get that space tested. Last year, we gave out most radon test kits that we've ever given. We gave out 74 kits. And, in previous years, we'd give out 50 or 55 or something like that, if that many. And then maybe 50% or fewer were returned and the actual tests were done. Last year, out of the 74 we gave, 76% of those were returned with testing. So, and I thought, well, that's fine, that's good. The State Health Department actually reached out to us and wanted to know how we managed to get such a high rate of return, because that was not the pattern throughout the rest of the state for this test program. And I think our big secret is Michelle, our office administrator. She calls people and reminds them, get those tests in. We gave one to you, so get it done. It's for your own health and safety and that of your family. So anyway, we will once again be offering radon test kits for free to residents. We will let people know when we have them available.
David, there's another variable, I think, to the good response rate of, returning of the radon kits in Darien versus other places in the state. And I believe a lot of that has to do with financial. Darien is more affluent than a lot of places in the state. And if you do come out positive with radon, I think the homeowner is responsible for mitigation. And so some people may be reluctant to return their kit just if they're not able to afford to have it mitigated.
Yes,
So,
and I agree. And I think the other reason why we had such a success rate is because we had so many people working from home. And, more people were spending more time in their homes, and they wanted to make sure that their homes were safe. So, I think that's a good angle to utilize in maintaining this high rate of return. So yeah, you're right, Christine. The good news about radon mitigation is it's not terribly expensive, but not everybody has a couple extra $1,000 laying around.
is that what it is, about a couple extra thousand? You see the pipes going up sometimes on the side of a house.
Yeah, it's disruptive to the extent where, they have to, in some cases, jackhammer out parts of the basement to put in a sub-slab ventilation system. But it tends not to be real expensive unless the area is completely finished and you have to tear out, finished basement and, nice walls and floors and carpet or tile or whatnot. It can, that part can get expensive.
If a homeowner does have a positive radon kit, Are they mandated? I mean, somehow enforced to mitigate, or like they don't come in and declare the house
No. It's your
habitable
property.
or something?
You live there, you own it.
Yeah, but
You know,
you know
so
how they can declare certain homes uninhabitable if something happened, you know, so that's not part of that. That wouldn't
no,
be.
and that's not an activity that I think that we or the town would want to get involved in, is to mandate. And then, you know, enforcement always becomes the key, no matter what it is, whether it's in the whole another realm of enforcement issues is you know, blight. You know, okay, you identify blight, how do you fix it? Noise, how do you measure it? How do you fix it? You know, because we continually get concerned. People call with noise complaints. You know, whether it's construction equipment or trash, garbage trucks coming early in the morning, um, leaf blowers, the ubiquitous sound of the drone of leaf blowers. Everybody knows and loves that sound.
Yeah, and in small plots of land, like, you know, a third of an acre or less. I mean, that can be very, very intrusive to
Yeah.
people when they're right outside their window.
And you know, as far as that's concerned, there are no, and that there is a noise ordinance, but the noise ordinance isn't really enforceable because state requirements are that you know, the noise measurements need to be done by someone who's trained in acoustical engineering, and we're not. And so you know, what we've had to do in the event of noise complaints is to hire a consultant to actually do it, because that's the only thing that would stand up if in court, if it went that way. All right, so radon, I'm pleased to report that last month you know, these quarterly things seem like monthly meetings, don't they? It just goes so fast. But anyway, last meeting, I think I mentioned also about the state having revised the recreational shellfishing areas and closing two areas. Well, since that time, they have realized that didn't need to happen. Unfortunately, they changed their maps to reflect the closure. And in conversation with Bill Cavers from the Coastal Commission, we have kind of discussed about enforcing what we were going to do to enforce the closure involving the police department. But since they've decided that it was premature to close those areas, we're not doing any follow-up to ensure that people are not shellfishing in areas that had previously been opened, because it's now an administrative process that the state needs to go through to update their maps to reinstitute what was. So that's the good news. The fact is that we have access to the areas that we thought we were losing access to. We don't ever really want to go backwards, right? You know, so, and we know that we're doing improvements all around our shellfishing areas of septic systems over time. So, you know, there's no way that I could see that water quality would be deteriorating due to septic systems, because we've been doing improvements over the years down there. Tomorrow, we will be at the farmer's market in Darien. We were there a couple of weeks ago. We will be providing free blood pressure screening. We will be offering free tick removal kits and identification cards, little magnifying glass with tweezers, so you know, people can remove the ticks and then identify them themselves. Also want to reiterate that if people do find ticks on themselves, they can access our website and get the address for the Connecticut Agricultural Experiment Station and send the ticks in, fill out the form, send the ticks into the ag station to have them be tested. So they don't test dog ticks. So if you find a tick on your dog, don't send it in. And if you do, they won't test it anyway. It's a great service. The ag station is wonderful, and the tick testing is a real benefit. Marijuana, legalized marijuana. I'm a co-chair of the Connecticut Association Directors of Health subcommittee on substance misuse. And so in that role, I drafted a letter for the association to submit to our senators to oppose, advertising for marijuana. If it's legal, I'm afraid next thing you know, there'll be advertising. And I did not see in any of the legislation regarding marijuana that there was anything about restrictions on advertising. I see a lot of advertising for sports betting. And the last thing I want to see is something about this with marijuana and have kids start seeing, oh, advertising, it's okay, So anyway, I drafted a letter of opposition to advertising for marijuana. We'll see where that goes. And finally, I think the last thing I had on my list that I wanted to share with you is that we are still planning on having our town hall medical emergency response team training organized soon. We had a little bit of a setback this summer due to staffing issues and illnesses and so on. So I'm pretty excited about getting that going, and that'll be spearheaded by Paula, our public health nurse. So that if somebody who's in the town hall, whether it's an employee or a visitor, has a medical event, that there are people who will be on hand to be able to respond and keep that person going until the official emergency responders get there. So that should be a reality within the next month or two. And I think, did I mention that we had a blood pressure session today, teaching people what the numbers mean and controlling blood pressure? And it was a session today for town hall employees that Paula ran. Also to bring in their equipment to make sure that it was calibrated right, because we have some new stuff of our own. And pulse oximeter, showed how to use that and what it means. So that was today. We've been busy. Never a dull moment in public health, as they say.
Thank you, David.
Full spectrum of activities.
I have to run to another meeting at 6 unless anybody has any pressing issues. Wonderful. Thank you all. I will believe we have a December meeting, isn't that right, David? And we'll send
Yes.
out the reminder for that when I type up the final draft of these notes. I'll send them out. Great to see everybody. David, thank you all for the great work, and thank you for the advisory board for your time. Appreciate it. Good to see everybody.
All right. Thanks, everybody.
Okay, thanks, everybody. Bye-bye.